The concept of systemic desensitization was originally developed by Joseph Wolpe in 1958. The procedure is based on the assumption that anxiety can be reduced by pairing anxiety-provoking stimulus with a response like relaxation that is incompatible with anxiety. It is, in essence, part of the behavioral therapy movement with treatment that begins with an assessment to identify and describe the objects or events that elicit fearfulness. Systemic desensitization is a behavior modification technique that exposes a person progressively to an object or event of fear while practicing relaxation. Then it continues with 3 basic procedures. First, the therapist teaches the patient to relax the voluntary muscles. A process of mindfulness is often employed, where the patient is guided to become aware of the physical sensations and focus on their presence. Then, together, the therapist and patient develop detailed descriptions of personal encounters with the objects or events that provoke fear and arrange them in order of increasing fearsomeness. When the patient is relaxed, the therapist tells the patient to visualize the encounters in an increasingly fearsome order. The therapist also encourages the patient to confront the fearsome objects or events in practice as they occur, keeping the relaxation and visualization principles in mind. Therefore, as a behavior modification technique, systemic desensitization weakens the learned association between the feared objects or events and anxiety by replacing the latter with a relaxed awareness. The premise is that once people learn to relax at will, they develop the ability to reproduce this state intentionally when they encounter an anxious situation. The therapist and client lists and ranks anxiety-provoking situations in order of intensity, and the patient is exposed to them in increasing order. When tolerance for situation is established, the patient moves on to the next one. As such, the patient becomes gradually desensitized to source of anxiety. The therapist and client lists and ranks anxiety-provoking situations in order of intensity, and the patient is exposed to them in increasing order. When tolerance for a situation is established, the patient moves on to the next one. As such, the patient becomes gradually desensitized to the source of anxiety. As already alluded to, systemic desensitization played a very prominent role in the evolution of behavioral therapy between the 1960s and 70s. The technique was documented early on as reliably effective for the treatment of anxiety and phobias. However, interest in the application of desensitization declined during the following decades with the advent of contemporary cognitive behavior movement, which offered approaches that seemed to have better outcomes. The criticism stimuli response approach in therapy was growing with arguments that cognitive factors deserved a more prominent role in behavioral theories. Some of the reasons of the questionable value of the systemic desensitizations are the following. Treatment relies on the client's ability to imagine the fearful situation vividly, which some people are not able to do. The treatment is only effective when the problem is a learned anxiety of specific objects or situations, events, and it can be a slow process that can take up to 12 sessions or so. Maybe the most important, as with most behavioral therapies, only the symptoms of disorder treatment, but not necessarily the underlying cause. Nevertheless, even today, there are many practitioners that advocate the validity of exposure and counter conditioning approaches to manage anxiety and related problems by incorporating some of the techniques in modern cognitive behavioral methodologies. In essence, anxiety is a response that are deeply rooted in conditioning learning. Therefore, the idea to unlink the circuit between anxiety and producing stimulus and neurotic responses with increasing exposure and counter conditioning. Although The fact is often stressed that suppressing symptoms does not modify the underlying structural maladjustments behavior. Therapists argue that it is appropriate that the treatments are kept at symptom level, as the symptom is the neurosis. However, a lack of insight in the underlying mechanisms and problems can easily overlook the effect of serious coexisting dysfunctions. Any questions, guys, before we move on to the next